Hey everyone, my name is Andy. I am a registered dietitian who specializes in nutrition for fatty liver disease and metabolic health. In today's video, I'm going to explain why eating as little as around 2 cans or 200 grams of sardines per week for 1 year can actually play a meaningful role in helping you to reverse fatty liver disease. Now, we have to identify that sardines are one of very few foods alongside salmon, mackerel, trout, and herring that contains large amounts of the omega-3 fatty acids, EPA and DHA, as well as large amounts of vitamin D, calcium, vitamin B3, all things which are important for liver health, by the way, okay? So in 2021, the Clinical Nutrition Journal conducted a study where they told people with prediabetes to have 2 cans of sardines per week or 200 grams of sardines per week for a year, and they gave them a bunch of other nutrition advice. And then the other group of people with prediabetes, they didn't tell them to eat sardines, they just gave them the nutrition advice. In the group who ate the sardines weekly for the whole year, there were additional reductions in triglycerides, in insulin resistance, in inflammation, and there was also an increase in HDL, or good cholesterol. Now, for those of you who have seen my videos before, you know that all of those markers are directly related to liver health and fatty liver disease. So even though they didn't look at the liver specifically in this study, I feel very confident to say if you are not eating any fish right now, and you're not supplementing omega-3 fatty acids, there's a very high probability that having a few cans of sardines a week. And by the way, if the idea of sardines is gross to you, try this. Open them out of the can, drain them, throw them in a frying pan or in the air fryer with seasoning. Let them get a little bit crispy. It's a totally different food, okay? So anyway, where am I going with this? Sardines could be a fatty liver superfood. And one of the big reasons is that people with a fatty liver tend not to have enough omega-3 in their liver cell membranes. What omega-3 fatty acids do is they go in cell membranes and they direct things, okay? They direct actions and they help with fat metabolism. People who have a fatty liver, they have low levels of omega-3 in their liver cell membranes, which means that their liver cells cannot tell fat where to go as well as they should, which means there's a higher chance that fat will be stored in the liver cells. And that's what fatty liver disease is, everyone. So yeah, I mean, the goal today, the message today is that small changes can make a meaningful influence on your health. Now, there's a lot of small changes that you can make depending on where you're at and who you are. So if you need the help of a professional to bring all those pieces together and give you a vision for what it looks like to eat in a way to reverse fatty liver disease, that's where I come in, my Fatty Liver Fighters coaching program and online course. Comment letter below, and I'll send you more information about it.